and I'm Mabel Jong. Thanks for joining us. You're watching WHCC TV. We're coming to you live from Washington, D.C. Thank you so much for joining us. Recently, Catalyst recognized Eli Lilly for their work in understanding the experiences of minority women. And we are here now with Joy Fitzgerald, who is Chief Diversity Officer at Eli Lilly and Company, to talk more about that award and to learn more about the programs. Thank you so much for your time today, Joy.
Thank you for having me here. I'm very delighted and excited.
All right, us too. So that seems like a pretty big honor to be recognized for your work in what seems like a very important area. Can you describe to me what sort of programs they were pointing at when they gave you that award?
Well, first of all, we were just honored and humbled to receive that recognition. And what was most important for us to even participate in the Catalyst process was we wanted to learn. They are a research-based company. We wanted to know what they thought we needed to do more of and less of, and throughout that journey learned that the work that we're doing deserved, from their point of view, recognition. Several years ago, we participated in a study called The Power of the Purse. And we learned that on any given day, all across the world, that 90% of healthcare decisions are made by women, for men, for children, for parents. So we kind of termed this gender equation that women are the chief medical officers of everybody's family. So that was a huge business case for us to understand gender in terms of healthcare. As we look at our global workforce, we're 50% women. But as we looked at higher levels of leadership, you began to see more men represented than you do women. So if women are the chief medical officers in our home, how might we deliver better services, better products, be a better business and a better provider to our patients if we really understood gender and the implications to healthcare in a different way? So we did what we always do. We went to research and data. But what was different about this, we leveraged an internal process of how we understand our patients in a clinical therapeutic area. And we said, what if we were to take that process to understand women, but also men inside of our organization?
Okay.
What was unique, we didn't just study your experiences here at Lilly. We wanted to know your experiences as early as childhood. What goes into the values that are taught to little girls that may or may not be different to little boys? How early is that built into one's DNA? And what are the implications of that when we start working? What goes into our decision making? And we learned a great deal about women, but also about men. And in particular, we termed some of those lessons and some of the challenges and tensions as moments of truth throughout a woman's career.
What were some of the things that really surprised you?
Well, you know, one of the things that really surprised us was this concept around stifled authenticity. And we even learned that there were cultural nuances to the term of authenticity. When we looked at women overall, men said that there are times throughout their career where they don't always show up as their full, authentic selves. But we saw a higher degree of that with women. And it was always a choice for majority women. So women in the majority population would say, I get to choose if I'm going to show up as my unique, true version of who I identify as. But I still can be successful without shifting my authenticity. When we looked at women of color, it wasn't stifled authenticity, it was surrendered. Those women felt that it was not a choice for them to be successful, that on most days they have to give up pieces and parts of who they are to be successful in a corporate environment. So some of those lessons were very eye-opening and insightful for us.
And how do you think you get from knowing these kinds of personal information about someone to how they make healthcare decisions?
Well, when you think about it, for example, I'll give you just one story I'll share. The cultural nuances is relative to how we make decisions is so important. And if you lack that awareness and or understanding, you might not help an individual be effective in their treatment plan and or their care. That could be life-saving. So if you think of, for example, and I will use the African American family, when a person is diagnosed with diabetes, how do they go about making the decision to take their medicines or to even accept that diagnosis? And for many African Americans, we learned that they would go to their churches and or their broader communities to engage them into making those decisions. When we looked at the Latino population, for many of them, to decide to take medicine or to even accept the diagnosis is very much dependent on engaging the family, the familia, having others understand the journey that they would need to take in order to reduce their blood sugar levels. Those things are very important. So even the language that the physician uses or the terminology with patients as it relates to culture and also gender is very, very important.
Powerful. Now, it is clear by getting recognition from an outside source that you're doing something right. You went into the process thinking that there was something to learn, but now you're set as an example of what others can learn from you. What is the biggest lesson Eli Lilly wants to impart to other companies?
I think one of the biggest lessons is that diversity and inclusion is just not a good thing to do. It's not just the right thing to do, it's the business thing to do. We are a better business because we are engaging in different conversations. We are addressing topics that, quite frankly, make a lot of people uncomfortable. But it's in our discomfort. We're learning so much about so many dimensions of differences that lie in each of us. And it's helping us to be a more inclusive and a more innovative company. I'd also like to share that it's important to link this work to results. Just as you do any other business area, we can't be doing this just because of goodwill. We need to be connecting this with the same amount of rigor, discipline, resources, and funding as we do all of our other core business strategies. And when we integrate that to the same level and set goals and aspirational results, then I think we will begin to yield some of the outcomes I know that we can when we have a diverse and inclusive workforce.
All right, Joy Fitzgerald, may I ask you how you're enjoying the Congress so far?
It's amazing. Amazing, great insights, opinions, thoughts. I have some ideas I'm certainly going to take back to our organization. So I'm delighted to be here as someone who's sharing, but I'm also here as someone who's learning.
All right, Joy Fitzgerald, thank you so much for your time today.
Thank you.
Really
Very delighted
appreciate
to
it.
be here.
And I'm Mabel Jong. Thank you for tuning in. Stay with us.